It's really a pleasure for me to be here and to share with you guys what we have been doing in the Delta. I want to thank our friends and partners, MEC, CED, and Kellogg for making this statewide tour possible and for pointing out what we see as a very critical economic and educational issue in particularly the Delta, but also the state of Mississippi. So I've been asked to spend a couple of minutes talking about some of the cutting edges in early childhood education that we're doing right here in the Delta. As a way of background, about 3 years ago, Rhea Bishop and Alita Fitzgerald with the Children's Defense Fund called us and wanted to talk about working with us on some of the early childhood education issues that we face here in the Delta. And part of their program of work, the Children's Defense Fund operates SPARK programs in 5 school districts around the Delta. And they wanted us to consider this as a program whereby we selected a group of Delta leaders to come together and see what was going on in early childhood education. Is that right, Rhea? Y'all twisted our arm and got us going, and we thank you for that. Based on some of the earlier work that we were exposed to, Delta Council understood the importance of the issue, and we felt that it was a good time to revisit it and allow a group of Delta leaders from across the Delta to come together and learn about these programs. Working with our partners at Delta Health Alliance, Mississippi State University, again the Children's Defense Fund, and the Kellogg Foundation and other entities, a group of approximately 15 of us went around the state, spent some time looking at best practices, backgrounds of the programs, and some challenges that we would be faced in early childhood education in Mississippi. And it really became evident to us during that time that there were a number of very good programs out there that were targeting and enhancing the quality of early childhood education in Mississippi, and most particularly the Delta. But due to funding issues, we found that these targeted programs could reach some of the people in just some of the time period. So couldn't reach them all, but in the first few years you could reach some here and you could reach some there. And what many of us discovered and we discussed is that we really needed a truly comprehensive model that could greatly change the experience of children in our community and thereby enhancing the overall economic and social well-being of our communities. This discussion led us to find the Harlem Children's Zone and see how it single-handedly has changed a part of Harlem, a very economically depressed area of Harlem. So a group of us, some people from Greenville throughout the Delta, went to Harlem 2 years ago to look at this model and learn what it was about. And we really went there before the Harlem Children's Zone has become a buzzword. I think many of y'all have probably heard it since President Obama was elected 2 years ago. And we learned that this comprehensive model was really everything that we'd heard about, and we decided to use this as a catalyst to bring home what they were doing in Harlem and to bring it back to the Delta. So when we got back, we got a group together. We worked with a research group out of Massachusetts, and we picked one pilot location in the region to put together what we are now calling a promise community. And this location happens to be Indianola. The Delta Health Alliance is working with local, state, and national partners to begin putting resources and finding resources in 2009 to begin building what we truly believe will be a comprehensive model of how early childhood education and health in Mississippi and the Delta could happen. There were already some things in place. For the past 2 years, Delta Health Alliance has funded with a contract through Mississippi State to operate a Promise School in Indianola in the summer. It's an intensive 4-week annual program for rising kindergartners, students who are getting ready to go into kindergarten. And we've had more than 100 students each summer participate in this really intensive program, tutoring and building and getting these kids ready for kindergarten. And this year, we've got the funding available to cover about 170 kindergartners. It's going to be every kindergartner in Indianola will be in this program. And then we all know that the best early childhood experiences start with healthy babies. So in that end, Delta Health Alliance for the past 2 years has funded 2 programs that provide one-on-one counseling with at-risk mothers, especially young mothers, to ensure that they have proper pre- and postnatal care. One of the programs is called Sisterhood, and it sponsors weekly meetings with teenage mothers who are in high school. And right now we've got about 30 women in these sessions. For the upcoming year, Delta Health Alliance will fund a comprehensive study of the entire early childhood network in Indianola. They're doing that right now. And they're looking to identify how the early childhood services are delivered, who's delivering them, and what the gaps are, what we're missing. There are about 150 to 180 at-risk babies born each year in Indianola. So if you'll multiply that times 5, 10, you get a picture of what we're working with here in the Delta. So we'll begin studying this, and in the meantime, we're going to reach out to our current our child care centers and homes, and provide owners with some of the technical assistance that you heard about earlier, and support to raise the level of our child care centers. In the meantime, the Promise community is going to focus next year on K through 4 with the goal of demonstrating measurable improvements in the statewide and national tests that 3rd and 4th graders take. We want to show that the money we spend in Indianola can generate results. So we'll offer a number of programs in the elementary schools in Indianola that are designed to help children achieve these skills for these tests. At the same time that we're focused on educational improvements, we're partnering with doctors in the Indianola area who will treat children and expand their practice. We want to provide every young person in the city with basic levels of primary care, and just as important, we want to assess any problems that might exist or might keep them from excelling. As you know, dyslexia is an example of a diagnosis that a lot of times we don't know about and goes untreated in low-income students. There's no question that adequate early childhood experiences are critical to helping prepare students for school. The goal of the Delta Promise community is not to stop at kindergarten, but we want to offer programs that help students excel all the way through school through the 12th grade. And all this we know is going to do nothing but create a better community for us all to live in. I'm pleased that I was asked to be one of the 12 community and business leaders who serves on an advisory committee for the Indianola Promise community. And we spent a lot of time ensuring that it is going to be successful. I'm proud to be there, and look forward to working and look forward to some of you getting to know what we're doing in Indianola. Let me close, because I know it's 1 o'clock and I'm a Rotarian and Blake's got a few more things to go, and Rotarians, and I'm sure Kiwanians do the same thing. They get out of here.
Yeah, you're done.
These efforts weren't just Delta Council. Delta Health Alliance, the Kellogg Foundation, Mississippi State, Delta State, Mississippi Valley, the Children's Defense Fund, and a lot of other people got together and worked. And I think it's just a clear example of how we in the Delta do things. When we know we have a problem or we know we need to address an issue, we've all worked together. And so I'm really proud of the fact that this group all came together, and we've done some good things. And we recognize that a lot of the efforts we've talked about today are either done in silos, such as the Indianola Project, or our statewide programs with little resources. This is simply a reality of where we are today in Mississippi. But if people like you that are assembled here continue to place an emphasis on early childhood education, we can continue to create replicable models that we can look forward to a much better day for our children and our economy, both in the Delta and across Mississippi. And I'm really proud that the Delta got started early. Thank y'all.